Excuse me, where did you get those blood sugars from?
Oh, yes. No, it's okay, it's okay,
Are you
it's okay.
okay?
No, I'm fine.
Are you sure?
Yeah. No, I'm good. It's just super hot outside. Really hot outside.
Yeah,
Are you
you're
okay?
Sweating.
No, I'm fine. I'm not, no, I was just having espresso. It's good. I'm good. We're good. I'll be out there. I'll do it right now. Let me just put this away. Thank you, okay? Okay.
Hey, did you get that blood sugar yet?
I'm looking for the glucometer. There it is. I'm on it right now. This is me going.
Easy. Hey, Eric, did you see that? Yeah. I've been having lots of problems with her lately. Earlier today, I walked into the break room. Her pupils were constricted. She was all sweaty.
No way.
I don't know what she's on, but she shouldn't be working here.
Are other people having these problems with her?
Yes! This is like the 4th time I've heard her acting this way. It's ridiculous.
What should we do about this?
Hey, bro. Remember that conversation we had earlier?
Yeah.
Let's just forget about it, man. I don't want anybody getting in trouble.
Really?
Yeah, can we keep it between us?
Yeah. You know, I can pick up the slack where, you know, she's not doing what she needs to do. I'll just do it.
I appreciate that. Thank you.
Help you out.
Cool. All right, man. Hey,
What?
what was that all about?
What was what all about?
The way you were acting back there.
How was I acting?
Are you on drugs or something?
What are you talking about? I'm just trying to do my job.
Well, you're the charge nurse. What do you think I should do?
Well, I would suggest that you document the time, date, and occurrence of each incident and then report that to the manager. But today, I'm going to suggest that she just go home because she doesn't look well and just take a sick day. Can I suggest you take a sick day today? So you just don't look so well today.
Okay, I guess.
We're having a serious problem on the floor with one of our CNAs. I provided documentation with each incident, date, and time. We're suspecting drug abuse. We're really concerned.
Okay, well, let me take a look at it, and we'll figure out what we can do.
Thank you.
Everyone. Alright, I've called you here today because we need to have an intervention for one of the employees on our floor, who I know that all 3 of you are familiar with. Because I know you've worked with her before and you've expressed some displeasure with the way that she's been performing. I've also called you because the 3 of you are friends with her. And the impression that I really want to give here is not one of accusation, because if Sarah has a drug problem, really the environment we want to create for her is one of help. Okay? So, we're here to give a positive message. Okay?
So we're basically here just to support
Yeah, you guys, if you guys to be here to support her and, you know, just kind of give a positive attitude towards this whole thing, that'd be great. Okay? Great. Alright, she should be coming in for her break any time now, so we're just gonna have a chat, okay? Okay. Sarah, sweet. How are you doing?
Huh?
How are you doing?
Alright, just trying to eat some lunch, yeah.
Okay.
Eating lunch. Okay.
We have a pretty important topic we want to discuss with you.
Okay. What's going on?
Okay, what should we call you here for? So this may be hard for you to hear,
Okay.
but there's been some complaints on the floor
And we love you. We want you to know that. We love you. We love you.
about your job behavior.
That was Mark.
And
Go ahead.
I want you to know, right here, that we are not trying to get you in any trouble.
Okay.
Okay, we just want to talk to you about some of these things. And I have a list here of the time and the dates that people have felt you have either come in late or come back from your break late, and some of the behaviors and the symptoms that we've seen you exhibit.
Okay.
And a lot of these are pretty indicative of a drug problem.
We're just concerned. We
Yeah.
care. We really care about you.
You know, I mean, some of
We're
these
just really
are,
worried.
as a clinical institution, we're pretty familiar with some of these symptoms here. And we just I wanted to present you with this information that we have, which is a pretty substantial case. But like I said, we're not here to get you in trouble.
Okay.
We are here to suggest to you that you have an evaluation done.
Like
And
just have somebody look at me?
we want you to be evaluated by a professional who's capable of diagnosing you or not diagnosing you with a possible drug problem.
Okay. So kind of like a shrink or something like that.
Kind of like a shrink,
Okay.
kind of like a doctor, kind of like a psychiatrist.
Okay.
And this is really important to us because your behavior and your personal life, as much as it's your personal life, has a pretty big impact on the functioning of our floor.
Okay.
We miss you when you're gone. We want you here.
Yeah,
Okay.
you know, like we really want to keep you as an employee.
Okay.
So I highly suggest that you take our advice and have this evaluation completed. Because unfortunately, otherwise, we have this other information here that merits a write-up.
Oh, yeah.
And we really don't want to get you in trouble. Again, you know, drug abuse and alcohol abuse is a disease. It's a problem that isn't necessarily in your control, you know?
It's true.
There's a lot of misconceptions about that, but again, we want to be supportive. So I have this information here. I have an evaluation form
Okay.
and a couple of names and addresses of people in the area, professionals in the area, who are accredited to evaluate your behavior.
Okay, so these people like are legit.
They're legit.
Okay.
They're legit. They're doctors, and they're going to evaluate you very objectively.
Okay.
So I want you to take this paper, fill it out, have the people on the other end, whichever therapist here you choose to go through,
Okay.
I want them to sign here and here.
Okay.
And I want to have you give this paper back to me within 14 days.
Is it gonna
Just
cost
shows
me
it.
anything?
It's not going to cost you anything because what's really great about working for this hospital is that your health insurance covers not only evaluation but treatment for a possible drug abuse problem.
Okay.
Up to 29 days of therapy if that's what this doctor decides that you need. Okay, so here's a list. Here we have the Employee Assistance Program
Okay.
here at the hospital that you can talk to.
Okay.
We have a private doctor here, and then we have Narcotics Anonymous.
You guys, do you think this is like a good idea?
We're just really worried about you, you know? We want to make sure that you get the help that you need if you have a problem. And I know that, you know, everybody struggles, but we just want to make sure that you're okay. We want you to still work here, and we love you, and
We love you.
yeah.
Yeah.
Thanks, guys. Well, yeah, I mean, I'll do it. I'll go evaluate.
Okay, that's great. We're really glad to hear that.
Alright, well, thank you guys for your support. I'll have it to you within 14 days.
Great, thanks,
Thank
Sarah.
you.
Thanks.